The topic for this presentation will be CPT coding for the integumentary system repair codes. We will cover simple, intermediate, and complex repairs. Do note that I repeat important information throughout the presentation. In my opinion, repetition makes learning stick. To remember information for the long term, a learner must be exposed to it several times and repeatedly practice recalling or retrieving it. Please read the 3 components of wound repair. Also read the instructions in the CPT coding manual before we move forward with this presentation. Let's first discuss how a skin wound is referred to as a laceration or cut. A cut is commonly conceived of as a wound created by a sharp item, such as a piece of glass or a nail. Blunt trauma frequently causes lacerations. Repairs are grouped together by the same anatomic sites, such as the face and hands. Repairs are grouped together by the same classification, such as simple, intermediate, or complex. For each anatomic site, the lengths of wounds are totaled together by complexity, which would be simple, intermediate, or complex. All the simple wounds of the same site groupings are reported together. All the intermediate wounds of the same site grouping are reported together. And all the complex wounds of the same site grouping are reported together. The codes group together sites that require similar techniques to repair. As an example, CPT code 12001 groups superficial for body sites, scalp, neck, axilla, external genitalia, trunk, and extremities. The extremities include the hands and the feet. When there is more than one repair type, the most complex type is listed as the first, or the primary procedure. The secondary procedure is then reported using modifier 59 for distinct procedural service. According to the guidelines, a simple repair is used when the wound is superficial. Superficial involves primarily epidermis or dermis, or subcutaneous tissues without significant involvement of deeper structures. This requires a simple one-layer closure. For intermediate, in addition to the skin closure, one or more layers of subcutaneous tissue and superficial fascia must be closed. Even though the closure was a single layer closure, you might record an intermediate closure with CPT code range 12031 through 12057 when the wound requires considerable cleaning. Complex involves sophisticated wound closure techniques such as a revision, debridement, extensive undermining, stents or retention sutures, and multi-layered closure. Familiarize yourself with the main term by reading the instructions for the use of the CPT index in the CPT coding manual. When coding for a procedure, we look for the main term in the index of the CPT coding manual. The index is located at the end of the CPT codebook. We start off by looking in the index for the main term repair. After reviewing the guidelines, determine if the wound was simple, intermediate, or complex. In this case study, an injury causes a laceration to the right hand, the right forearm, and the left thigh. The physician repairs the lacerations using one-layer closure of the 3 anatomical sites. In the index, we would look at CPT codes 12020 and 12021 under simple wound repair because the case study mentioned a one-layered closure. CPT codes 12001 and 12011 is used for the most basic type of superficial healing for wounds ranging in length from 2.6 to 7.5 centimeters. A superficial wound of an anatomic site that involves the epidermis, dermis, or subcutaneous tissue is closed by the physician. Pay attention to the anatomic site and the length of repair. The wound does not go deep into the subcutaneous tissues. Tissue adhesives, staples, or suture materials are used to perform a basic single-layer closure. A superficial wound is the outermost layer of the skin, which is known as the epidermis, and is affected due to injury. Take your CPT book, open it to the main text, and refer to the CPT code or codes that you found in the index. We will discuss the simple repair of superficial wounds. Write the keywords next to the repair simple category. All simple wounds of the same site grouping are reported together. The hand is 2 centimeters, the forearm is 3.3 centimeters, and the thigh is 1.9 centimeters, and are wounds of the same site grouping. So now we will add the length of repairs for each body site. The total length of the wound repaired is 7.2 centimeters. So the correct code for this repair is 12002. In this next case study, we have a 3 centimeter scalp laceration with layered repair and a 2.5 centimeter laceration of the forearm. let's discuss intermediate repair codes 12031, 12041, and 12051. These codes are used for intermediate repairs of wounds up to 2.5 centimeters or over 30 centimeters. Look for the specific anatomic site in your documentation. Look for specific keywords in the documentation as to the type of laceration repair. Some keywords: deeper layers of subcutaneous and non-muscle fascia, layered closure, or deep layer suturing. Now we will focus on intermediate wound repairs, so open your coding manual to the main text that contains these codes. I find it helpful to make notes in the CPT coding manual of keywords, and I write them next to the category heading for Repair Intermediate. The keywords for an intermediate repair are deep layers of subcutaneous and non-muscle fascia, layered closure, or deep layer suturing. Focus on the keywords before you attempt to apply the CPT code or codes. The keywords are outlined here for you. Would you say this is an intermediate wound repair? Could there be two complexities of repairs in this scenario? Think about it before I give you the answer. For the scalp laceration, the repair was 2.5 centimeters. The forearm had a layered repair of 2.5 centimeters. The 3 centimeter scalp laceration with layered repair is coded with CPT 12031, and the 2.5 centimeter laceration of the forearm is coded with 12002. Next, let's discuss complex repairs. CPT codes 13100, 13131, and 13151. Look for the specific anatomic site and length of repair. Complex repair, also known as multi-layered closure, involves more than a layered closure, which involves extensive undermining, stents, or retained sutures. Preparation for this treatment comprises creating a defect for repairs. As an example, excision of a scar that requires a difficult repair, or debridement of complicated lacerations or avulsions. When assigning complex repairs, look for the specific anatomic site and length of repair. Complex repairs are frequently reconstructive procedures that include the formation of a defect to be fixed. As an example, scar excision and subsequent closure. If a lesion is removed, it must be reported separately. A Webster type subcutaneous suture, a Gill's corner stitch, and/or a stellate laceration repair may be used as part of this treatment. Code range 13100 to 13153 are for complex wound repairs. Take a moment to write the keywords next to the complex repair category. Go back and read the coding guidelines. Determine if this case study is simple, intermediate, or complex. The correct codes are 13101 and 13151. In this case study, we have a young man who was in a fight at a local bar and presents to the emergency department with multiple lacerations. The physician evaluates him and determines that he has a 2.5 centimeter gash to his left forearm and a 4 centimeter gash to his right shoulder. Both require layered closure. He also has a simple 3 centimeter laceration on the forehead that requires simple closure. What are the correct codes for the laceration repairs? Think back to the keywords for simple, intermediate, and complex. In the last case study, we are coding for the repair of a 3 centimeter laceration of the left chest of a young man involved in a fight involving a knife. Please review the CPT codes and focus on the code that contains the anatomic site, the classification, and the length of the wound. How will you get the answers to these 3 last case studies? Read the guidelines, refer to the keywords, and use the CPT index and the main text. The correct code will come to you if you follow the coding path, which includes searching for the main term in the index and confirming the code in the main text of the CPT coding manual. I want to thank you for watching this presentation, and I hope the steps were easy for you to follow. Please like and subscribe to my channel.